Well, greetings to all our distinguished guests, and thank you to the TIDES team for the invitation to speak. I'm Colonel Jonathan Craig Taylor, the Command Surgeon at the United States Africa Command, known as AFRICOM. On behalf of the entire command and the team at AFRICOM, we extend our warmest greetings and hope that this finds everyone well and free from COVID. In my brief presentation today, titled Sustaining the Health of the Force and Partners in Africa, I will provide a brief overview of three main topics: the mission and the posture of the command, our initial thoughts in response to COVID, and building healthcare resilience moving forward. First, I will offer a disclaimer. The content of this presentation does not represent the views of the United States Army, Headquarters USAFRICOM, the United States Department of Defense, or the US government. And the presenter, that's me, has no relevant financial interests. To begin, I'd like to offer a few words about the command and the unique mission. As most of you know, the Department of Defense assigns various regions of the globe to organizations known as the Geographic Combatant Commands. AFRICOM, obviously, is mostly concerned with Africa. Africa is the home to the fastest growing economies and populations in the world. It sits at the crossroads of international commerce and trade, and it watches over the world's most important sea lines of communication. As the Geographic Combatant Command, with headquarters here in Stuttgart, Germany, we strive to assist our African partners to solve problems, develop security solutions, and that will ultimately bring prosperity and stability to the African continent. AFRICOM employs a whole-of-government approach, partnering the Department of Defense, the Department of State, and USAID inside a unified command structure. These three pillars, referred to as the 3Ds of defense, diplomacy, and development, all seek to advance U.S. interests and certainly to support our African partners on the continent. We believe that African solutions to Africa are the most crucial thing to support long-term development and security in Africa. Africa faces numerous challenges, from changing demographics and poor governance to malign actors. In addition to these challenges, coronavirus poses an additional ongoing threat and requires creative approaches and to continue our operations and strategic engagement on the continent. Africa, though, is also a land of opportunity. Over half of the world's arable land is in Africa. And if effectively managed, Africa's population that's growing and its rich natural resources could drive tremendous progress. All of these factors create a very dynamic environment to work in and to build optimal healthcare infrastructure. Comprehending the sheer size of Africa is sometimes very unique. The continent contains a unique people groups and languages across the breadth of the continent. The distance creates operational and logistical challenge as we look to support U.S. personnel across the continent. But using a wide transportation network and partnership with allies, we find that we have these critical enablers that allows us to support widely dispersed U.S. interests on the continent. A brief word about population. 17% of the world's population currently lives in Africa. We expect to see explosive growth on the continent over the next 30 years, where by 2050, Africa's population will double. By 2100, Africa's population is projected to almost double again. At that point, almost 1 in 3 people will live in Africa. It's important to remember also the backdrop of endemic disease that exists in Africa. Africa has the highest burden of infectious disease in the world. In the first 21 weeks of the COVID pandemic that saw 500,000 COVID cases and around 12,000 deaths in Africa, in that same time period, there were nearly 200,000 deaths from HIV and AIDS, nearly 170,000 deaths from tuberculosis, and over 160,000 deaths from malaria. Other diseases that are rarely found in the developed world, including measles, cholera, Ebola, and meningitis, also kill and harm Africans at alarming rates every day. COVID adds an extra layer of complexity to the situation. During the initial waves of the pandemic, all nations sought to protect their populations, their healthcare systems, and to test for the presence of COVID. This created a global demand for personal protective equipment, testing materials, and a very limited number of pharmaceutical treatments. Most countries found themselves competing on this global market for these very limited resources, and African nations also sought to secure the necessary materials they would need to combat COVID. Many African nations struggled to source sufficient COVID tests particularly, leaving healthcare officials wondering the true presence and the prevalence of COVID. As the Hopkins website data suggests, underreporting likely obscured and maybe still obscures today the true incidence and prevalence of COVID-19 in Africa and in other parts of the world. At the beginning of 2020, we watched COVID move from Asia to the Southern Europe and then begin its march into Northern Europe. AFRICOM examined what it thought were the most critical capabilities to protect and to preserve. The Office of the Command Surgeon, of which I work, is essentially the Chief Medical Officer for the command. We identified several critical tasks and systems that we felt could not falter due to COVID. We asked fundamental questions. What are the critical healthcare systems? How are they vulnerable? What do we need to do to augment or protect these systems? What activities should we suspend to free up resources? And what resources are we competing for today? What resources will we compete for tomorrow? With that framework, we identified 3 overarching tasks that we needed to protect and preserve. These were protect the theater trauma care and evacuation system, protect the force, and enable the health of our African military partners. So obviously the most critical task to preserve was our theater trauma and casualty care evacuation system. The system provides life-saving care in the event of accident, injury, or illness. We recognize the need to reinforce that system with additional capabilities to include clean and contaminated facilities with the necessary healthcare professionals to staff those. For the U.S. forces to remain ready in Africa, we needed to protect this critical safety net and that safety net that this system provides. Without question, though, protecting the force was another very important task. At the headquarters in Europe, we rapidly adapted a strategy to mitigate the effects of COVID. Earlier in my presentation, I mentioned the idea of the 3 Ds of defense, diplomacy, and development. Well, we co-opted this very familiar mnemonic to also represent distance, disinfection, and deliberate decision-making. We spread the workforce out to maximum extent. We disinfected our hands and our workspaces. We reduced the items we touched, we masked up, and we maximized virtual meeting spaces to minimize the gatherings and large groups. We structured many of our office workspaces to better protect ourselves, and this overall became our 3D strategy. The 3D strategy proved to be a highly effective strategy in the workplace to mitigate the impact, while preserving the health of our force and our ability to operate. The forces on the continent adopted many of the same approaches to mitigate the spread at their locations. We sought to provide testing as well on the continent. To continue to build up the testing capabilities, again, that would allow suspected cases to be able to be tested. And we could also test the forces as they rotate on and off the continent. Many of you are also tracking that the Department of Defense has invested significant interest in testing and vaccination, and we are closely synchronized with the DoD-wide efforts to provide these capabilities. So the U.S. forces also have remained largely engaged on the continent, and we have diligently guarded their health and the health of our host nations. We remain ready to support and engage our African partners by the means that are necessary and any means that we have at our disposal. One of the most important tools was the Overseas Humanitarian, Disaster Assistance, and Civic Aid programs, known as ODACA. This program has allowed us to continue to make donations of personal protective equipment and testing supplies to our partners. USAID has also made significant contributions in Africa to support the COVID relief, to include ventilators throughout Africa. The photo here highlights a recent shipment to South Africa. This is a good point for us to pivot to the last segment of the talk, which is about building the resilience moving forward. We all recognize that COVID remains here for the near term, and possibly through a significant portion of 2021. Knowing this, we all recognize the need to work in the COVID environment and return our focus onto other health threats that exist. I will only say this of myself, but feel free to identify with this if it applies to you. I feel like that COVID has been a bit all-consuming. As we consider the health landscape, COVID has dominated much of my professional work and my attention. While important to address, I recently began asking myself, what are the other important issues that may have been neglected as we focus on COVID? The discussion extends into many spheres and often falls on policymakers to try to balance the many competing issues. But for those of us in the healthcare profession, we have no shortage of medical issues that we need to revisit to make sure we are appropriately addressing them all. While numerous health concerns exist, just a few of which are listed here on the slide, I will use the remaining time to address just a few issues that should garner our focus, particularly in Africa. Alongside the threat of COVID-19, during the year 2019, the Democratic Republic of Congo was working to control a measles outbreak that infected over 300,000 citizens and unfortunately claimed over 6,000 lives that year. It reminds us that persistent threat from diseases that we can vaccinate against will always remain. As the slide indicates, measles vaccinations have saved over 21 million lives in the modern era, but that threat still remains. As health systems and workers shifted their focus to COVID-19, these vital programs often became vulnerable to disruptions, both in vaccine, supply and delivery, relocation of healthcare workers, or just disruption of these services. The protection of healthcare workers also became a very important issue, particularly when the supplies of personal protective equipment became limited. Travel and movement restrictions, often aimed at limiting the spread of COVID, may also affect the access of both workers and those seeking to be vaccinated from vaccination sites. Overall, it's critical to assess the impact on vaccination programs, both in the US and abroad, and determine how quickly we can get these programs resumed. The long-term benefits of vaccination are well established, but the risks of vaccinating the not vaccinating populations can be very significant. Another example would be polio. Since the 1980s, the global effort to eradicate polio has been very effective. The WHO Africa recently did declare that Africa appears to be free of the wild-type polio at the present time. Despite this apparent victory, it remains critical to continue vaccination for the foreseeable future to prevent any reemergence of wild-type polio that might be currently undetected. The question becomes, how do we sustain these efforts, similar to measles, with the challenges that COVID presents? One option to consider is when can engaging the infrastructure that exists, when can this be possible to use to create or to confront challenges on both fronts? Often small modifications to training and resourcing can allow vaccination infrastructure and efforts to offer solutions to several problems, to include emerging threats. For now, all of us should be trying to determine how we can best continue or restart, if necessary, vital health functions, to include vaccination. We at AFRICOM have tried very hard to remain engaged with our partners during these challenging times. With constrained travel and limits on personal meetings, we have tried to engage our partners by doing just as we are now, virtually. One example is leveraging existing relationships and partners to support the current pandemic. The African Partner Outbreak Response Alliance, let me return to my previous slide. African Partner Outbreak Response Alliance is an African-led collaboration sponsored by AFRICOM and the United States Air Force. It currently has 26 partner nations, primarily military medical personnel, but also includes Ministry of Health personnel. The collaboration seeks to help us better plan and respond to pandemic disease. The last in-person meeting was in November of 2019, just happened to focus on standing up emergency operations centers, something that most of us would do just a few short months later for COVID. Our recent virtual meeting, which was pictured here, focused on the lessons learned and the planning efforts in response to COVID-19. Engaging in new and creative ways is critical as we endeavor to show our ongoing commitment to our African partners. So to conclude, Africa is one of the fastest growing economies and populations in the world and sits at the crossroads of commerce and trade. Africa is a vital continent and of great strategic importance to the United States as well. Supporting African health and health infrastructure remain a top priority of the command, and we recognize that our role across the spectrum of defense, diplomacy, and development are critical to achieve these goals. What US Africa Command accomplishes every day with relatively few people and modest resources on a continent that's 3.5 times the size of the continent of the United States is a testimony to the command. US Africa Command diligently works to ensure our mission supports our African partners while they strive to solve complex issues that have a direct impact not only in Africa, but around the world. I would just like to thank you today for the opportunity to speak